It is so great to see you all. Thank you so much for joining us this evening. We are so excited to present to you tonight a panel discussion on administrative internships. My name is Elisa Na. I am a second-year administrative fellow at the Mayo Clinic, and I joined this all community. I don't remember when, but it's been quite some time now. But really excited to be a part of this group, and we've got some exciting discussions just waiting. So thank you again for joining us. And with that, we're going to go ahead and kick us off. Next slide, please. So just to kind of get us started, I did want to mention that this event is in partnership with Ladder. We are so grateful to have this type of collaboration and partnership. And Belisha here will be representing Ladder, and I just want to hand it off to her to introduce herself and Ladder, and then we'll get started.
Yeah, thanks so much, Alyssa, for just having me here, and thank you, Eddie, for the invite as well, too. As Alyssa mentioned, I'm Belisha. I'm with the founding team at Ladder. I actually got an MHA like many of y'all here, and then worked in healthcare for some time as well too. So currently at a startup called Ladder, we're building a professional community platform for the next generation. So when you get the chance, would encourage you to take a look afterwards. Eddie can feel free to shoot over the link to sign up. But basically we're trying to democratize access to career growth. Think of it as kind of like the anti-LinkedIn, where instead of having to put on a facade and having to have your career all figured out, we're building a place where people can come and join communities and be able to engage in career discussions, be able to build meaningful connections and attend things like events like this one here, be able to connect over coffee chats and all that good stuff. Yeah, for us, we're really focused on early career professionals as well too. So it's an opportunity to connect with people who are very like-minded. And we have communities on our platform, including a grad school community, a healthcare community, a business community, even a consulting community as well too. So I'd love to have you all join us on Ladder and be able to feel free to DM me, connect with me on there as well too. And I'll hand it back off to Alyssa to take on the rest of this.
Awesome. Thanks so much, Belisha. Again, really appreciate the partnership and looking forward to this discussion. Next slide, please. So I want to kick us off with some really exciting news. Since our last event, we hit a major milestone as a community, and we've reached over 1,000 members. And so again, we're just really grateful for this incredible network that's been built, and really appreciate all of your engagement, all of the contributions. Personally, I've learned a lot from this community, and I've had a ton of conversations with people across the country, and really appreciate that. And it's really kind of crazy to think that this group has only been around since July of 2020, because we've certainly come a long way. So really excited to see what the next new year has in store for us, and I'm looking forward to continuing to build and grow as a group. Next slide, please. So before we actually get into tonight's event, just wanted to give you a quick recap of the last panel discussion, which was on healthcare consulting. Again, really, really grateful for the participants, Simran, Sol Lee, Austin, Hong, and Sana. I think that personally was really insightful for me, because that healthcare consulting was not a professional route that I had considered. So I thought I learned a lot. We had 75 attendees in total, and if you weren't able to make it, we did record it, and you can access that on the YouTube page, and this PowerPoint will be sent after the event. Next slide, please. Also, some other good news. We really also wanted to take a moment to congratulate all of the all members within our group, our community, who have secured an administrative fellowship. It's not an easy process. It's quite stressful, as I'm sure you all know, and so really just applaud all of your efforts. I know it's been a long process, and now it's just smooth sailing from here. So, finish off the year strong, and really looking forward to seeing how your fellowship experience goes. Next slide, please. All right, so I have the honor of introducing Mehul. He will be our moderator for this event tonight. He is currently an MHA candidate at the George Washington University. And so with that, Mehul, I'm going to hand it over to you and let you take over. Thanks so much for being here.
Awesome. Thank you so much. So before we jump into the panel, just wanted to thank all the panelists, and also those of you who have joined from across the nation. So we hope you actually gained some valuable information from today's session. All the panelists have some great experiences across various health systems through their administrative internships. So we really hope you guys are able to gain something valuable from this panel. So we can kick off today's panel with some panel introductions. Keshni, you want to go ahead and start us off?
Yeah, so first of all, thank you so much for having me here. My name is Keshni Kokilakumar. I'm an MHA and MPH candidate at the University of Georgia, and I'm currently also interning at Providence in Southern California. I am in Georgia, so it's a remote internship. So thank you so much for having me here.
Justin?
Great, yeah. Thanks everyone for having me as well. My name is Justin Park, and I'm a second-year MHA candidate at the George Washington University here in DC, and I was a former administrative intern over at the Cleveland Clinic this past summer within their Orthopedics and Rheumatologic Institute.
Thank you, Justin. Celine?
Hi, thank you so much for having me. So I'm a second-year MHA student at Cornell, and I'll be graduating in May. I did my past internship at Vanderbilt University Medical Center in their cancer department. And then after graduation, I'll actually be with Surgical Care Affiliates. They're an ambulatory surgery center. And yeah, so I'll be in Chicago after graduation.
Awesome. Thank you so much, Celine. Karen?
Hi, I'm Karen. I'm a second-year MPH candidate at the University of Minnesota in Minneapolis. And I was a former graduate administrative intern at Massachusetts General Hospital in the research department.
Awesome. Thank you guys so much. So kind of a quick timeline for today's panel. We're going to go into some of the questions you guys all submitted, and then we're going to save about 20 minutes at the end for Q&A. So just a quick note, if at any time throughout the panel, if you guys have any questions, there's a Q&A function at the bottom for you guys to submit any questions that we're going to spend the later half of the panel going through those. But other than that, we can go ahead and jump into the panel. So the first question you guys kind of all submitted was, what did a typical day look like for you during your internship? And Justin, if you want to go ahead and kick us off with that one.
Sure, great question. So a typical day, well, I'd say that for the most part, it wasn't a monotonous experience. So I've had the pleasure of trying out different things, but also the pleasure of actually being in Cleveland physically this past summer. And I guess a general day would be kind of getting into the office in the morning, checking in with my preceptor, doing some different project work. But one of the most memorable aspects of being there over at the Cleveland Clinic was actually deep dive sessions that we had on a weekly basis, where we would engage with different enterprise leaders, whether we were interested in regional operations, international operations, market network services. There was just a great variety of different areas we were able to learn about. There were also different opportunities to be a part of working groups across the enterprise. So for me, I had the pleasure of being part of the surgical transformation huddles, which took place every Wednesday. And that was just an opportunity for different leaders from different institutes to come together to think more critically about how to operationalize and improve the use of operating rooms across our main campus. And so, yeah, I mean, a typical day is sort of hard to mention just because each day was a little bit different, but that was sort of the gist of my experience over at the Cleveland Clinic.
Awesome. Thank you, Justin. Does anyone else have, Karen, Keshni, Celine, anyone want to pitch in what their day looked like?
I can go ahead. So yeah, very much so echoing off what Justin said, very similar. But I always started my mornings with huddles. So there was a COVID huddle or a safety huddle, and then had meetings, and then had a lot of project work. And then towards the latter half of the internship, when I was there in California, I started doing a lot more rotating work. So I would visit a lot of our medical groups in our hospitals. So kind of really interesting to have variety. But yeah, I don't know if I had a typical work day. It was very busy through and through. So I guess maybe that was the one thing that was constant. So, but it was really great.
Yeah, I think as I've talked to other administrative interns, it's like you're doing something different every day. So just answering that typical day question becomes a little bit difficult. But Justin and Keshni, you guys both talked about some of the projects you were able to work on. Celine, do you have any experiences can you speak on some of the projects you talked about?
Yeah, for sure. So I think one really unique thing about Vanderbilt is they did offer some projects going into the internship, and they listed it actually as part of the application process. But once I got there and really got to know my preceptors, and I had the opportunity of working with a lot of different types of leaders. So there was one of my preceptors was a fellow, and then the other one was a more exec level leader. But I actually got to choose some of my own projects, which is really cool. And one of them that I chose was an operations focused project. So since I was in the cancer department, the patient sequence in the cancer department is it's very set in that all the patients, new patients especially who come in, they have to get their lab drawn. And so the lab was experiencing this huge bottleneck. And so kind of implementing this lean strategy and kind of process optimization, that was the main bulk of this project. So I kind of took on initially an internal consultant process, kind of from solution ideation all the way to implementing and change management as well. So, you know, as an intern, I did not expect to have like half as much power as they gave me over this project, but honestly, just finding the right community, I think, is a huge part of it, because once you establish that trust with your preceptors and with the leaders in your organization, they really do trust you to take on these processes and just oversee all of these projects. So that was one of them. And then the second one, the second main project that I had was more of a business development project. So I was working with a stem cell department and specifically their patient lodging assistance program. And so kind of developing partnerships with them to offer their patients reduced cost or even free housing options. And also building that business case for even investing more resources, maybe into budgeting or just finding opportunities to realize these higher margins. So that's kind of very brief overview of what I did this summer.
Awesome. Thank you so much. Does anyone have any cool projects they worked on? Karen, Keshni, Justin?
I think for me, I also came in and they already listed 3 projects that they were looking for me to work on. And so after I already started working on a few of these projects, my preceptor asked me, do you have any other interests that you would like to acknowledge or to gain during this experience? He asked me what kind of skills I was looking to improve on, or if I was looking to, if I had any like other passion projects. So for me, immigration is a big thing. And at Massachusetts General Hospital, they did have an immigration center. And because I stated that interest, he was able to connect me with those people in charge and kind of help me look for what I was looking for, but also try to find a project that suited my needs, but also organization's needs. So very broad answer, but yeah, they, in my experience, they really work with you to find out what they need as an organization, but also to meet your needs.
Awesome. Thank you, guys. So moving on to the next question, as we're interviewing and applying to these different internships, culture is one of the kind of terms that's thrown around a lot. We're always trying to get an idea of what the culture is like, what the organization is like. So Keshni, can you describe the culture of your internship site and kind of some tips you had on figuring out what the culture was like, what kind of triggered during interviews, things like that, and on tips on how to succeed at the organization you were at?
Yeah, I definitely can. So I think right off the bat, one of the first things that I was told is that when you're interviewing, even if it's just an administrative internship, you're interviewing them as much as they are interviewing you. And so really to start with the second half of the question, sorry to go off track, I really made sure that the conversations that I had, so for me, diversity, equity, inclusion is very important to me. Immigration is also important. I know Karen touched on that. And working with refugee populations and professional development. And so for me, when I was having conversations with and going through interviews, I made sure to ask questions about those topics and areas. I kind of got an understanding of how they viewed those topics, especially as we are becoming more diverse as, you know, a country and whatnot. And so that kind of helped me understand the culture, but then also walking in, I'm not sure how the other administrative internships kind of their interview process went, but my final interview, I actually interviewed with my boss or my upcoming boss and really got to understand how he functioned as an individual. So asked a lot of personal questions for him. So in this situation, what would you do? And kind of was able to understand how he ticked as an individual and then also how he would tick as a preceptor. So that kind of lets you know not only just the organizational culture, but the culture between you and your preceptor. And so I guess when I walked into Providence, you know, it's a very family oriented. I know you hear family thrown around a lot, but it really is a family oriented internship or administrative steering committee. A lot, like Karen said, how her program really made sure that they catered to her interests as well. They had a set level of projects that they wanted me and the other administrative intern to work on, but they also made sure to focus on what we were really interested in and what we wanted to develop. And so that was really important for me, and that was a really great culture, because it's really not so much of a you need us more than we need you, but we could really value from what you can bring and all of the insight. So that's really, really important. As for some tips, I guess when you're in meetings, I think Celine maybe talked about this and touched on it. It can be a little intimidating. Fun fact and some context, I'm 5'2", so I have huge imposter syndrome because everybody looks down on me, like literally. So it's really hard for me to speak up in meetings, but you really know how great an organization is if they really push you to speak and say, what are your insights? What are you thinking? And I would really encourage you to do that, because even if your insights are maybe wrong, whatever wrong means, it's still a valued perspective. So those are some tips that I would use to succeed is, yes, say yes, take initiative, and really speak about your perspective, because chances are someone's probably never thought of that before, and it's probably a really great piece of perspective that no one ever thought about.
Thank you. Does anyone else have any great experiences about the culture of their organization?
Sure, I can chime in here, and want to echo a lot of what Keshni said. So, going in for me as well, one of the big things was definitely an organization that put DEI at the forefront of their philosophy and what they were doing each and every day, especially during this political and social construct in these times where there's a lot of different heads that are budding. And for me, one of the things that really stood out during my interview with Cleveland Clinic was that it's an environment that requires a lot of work, and it's a very high functioning, high caliber place, but it's also a place that has a very high levels of support. And that was what really stood out to me is I wanted to go into this internship with a really open mind, and ultimately just wanted to walk away from it having absolutely no regrets around something that I didn't have an opportunity to take part in or an opportunity to ask about. And so definitely look for an organization that's willing to bring you on and treat you as more or less an equal, rather than just another intern or another number. You want to go into this experience and really walk away feeling as if you've been able to contribute meaningful work and a meaningful experience for yourself as well. And I guess a tip, kind of going quickly into a tip, don't be afraid to try new things. I came into the program really gung-ho about strategy and wanting to go into the strategy development space. But, fortunately, I was placed in the Orthopedics Institute, which wasn't even listed on my top 3 list of the placements that I want to take part in. But ultimately walked away just really loving clinical operations and the ability to engage with and interact with different physicians and clinicians across the enterprise. And internships, are really a safe place to fail. So if you're going to fail, do it now rather than, in your fellowships or your jobs post-fellowship.
Awesome. Thank you, guys. So Keshni, you touched on how important asking questions were and kind of getting to know the organization. And one of the questions you all asked through the poll was, how do you really stand out? Because there's so many individuals applying through these internships. You kind of feel like you might just be another applicant or another resume on the pile. And so, Karen, can you talk a little bit about what kind of helped you stand out during these interviews?
Yeah, so for me, I try to look at what I was looking for in an organization, but also what I could bring to that organization. And for me, because I eventually did get placed in the research department at Massachusetts General Hospital, I was able to speak out about my previous experience in research before, my passion for it, and what I believe could be what's beneficial in relation to research, but into a hospital setting. So like it leads to innovation and things like that. So like being able to really speak about what previous experiences you had or what you're looking to gain, but also identifying whatever strengths you feel are valuable that you own, but that also an organization can use is really, I feel like it's really something that they're looking for, and it's a memorable trait to have when you're interviewing.
No, yeah, that's very important. I think one thing that, as I'm talking to kind of fellows or interns, one thing that they keep mentioning is stick to your values, and the organization will kind of cater towards that. So that's really important. Thank you, Karen, so much. Does anyone else have any tips for interviews or kind of how to stand out?
Yeah, I can jump in here. So, I mean, this might sound a little hokey, but I promise it's not. I think part of it is really finding an organization that really values your potential and really understands your potential. And then also kind of like on the transactional end is willing to provide you with a mentorship to achieve that potential. A lot of organizations that you apply to will focus on your resume and what you've achieved already in the past is kind of this indicator of what type of intern you're going to be. But I would recommend, connecting with people, really understanding the organization even before you interview, to really look for these preceptors and organizations who will genuinely invest time and resources into you to help you achieve that. And I think something that you can do to make yourself more competitive is to really be able to verbalize that potential, because I don't think a lot of people are able to do that, especially, I mean, there's a very fine line between being arrogant and knowing what your worth is. But yeah, I mean, your experiences will speak for you, but I think there's a lot of power in being able to differentiate yourself from other applicants, just in being able to verbalize confidence in your own potential too.
No, that's perfect. Keshni, did you have something to add? I saw you unmute yourself.
Oh no, Celine tucked everything and wrapped it up perfectly for me. I think the only thing that I would rather add is that, yes, like Celine said, really just do your research on the organization and then tie it to your why. You don't want to just sit here and start spewing out facts about the organization because they're like, why are you telling me this? This is not the point of the interview. You really want to tie it to your why. And oftentimes they'll really, when you get an interview, they'll tell you who's interviewing you. So do your research on those people, and you might find things that you have in common with those individuals. And definitely say, definitely talk about that during the interview. But again, connect that to your why, or connect that to you, or connect that to what you're interested in.
Awesome. So we talked about some projects, we talked about culture, interviewing. One thing that a lot of you guys had questions on was kind of timeline. When should I start applying? When should I start reaching out, networking on LinkedIn? All those questions kind of were submitted. And so we wanted to ask Justin, what was your timeline kind of like? What does a traditional timeline kind of look like in terms of applying to a lot of these larger health systems like Cleveland, Mass Gen, Mayo?
Sure. So I know that different programs will probably have different timelines because some people may be graduating earlier than others, but for me, graduating, I'll be graduating in May of 2023, so some time left. But I started looking pretty seriously at internships probably around the October before the summer of the internship. And I know that some of the larger health systems have started to recruit earlier and earlier. And I believe that even Mass Gen might have closed recently, and clinic as well. So I personally started as early as possible, and I never think it's too early to reach out to people that might have been former interns there or current fellows there to just briefly ask about their experiences, learn a little bit more about them. It doesn't have to be formal interview where you have to dress up and kind of meet them via Zoom, but it can just be a casual phone conversation. Learn a little bit about them. Learn a little bit more about the organization, gain some early insight into, if this is a place that you can see yourself. Is this an organization where, you think their interns and their fellows are being valued? Is this an organization where you may, want to potentially, join later down the road? Or is this just a place that you thought you were really interested in, just absolutely, just like after the phone call? And that's really fine as well. So for me, I think it's best to start as early as possible. And once again, that timeline is going to look different for different programs, but take the initiative and be very intentional about the entire process. It's going to be a lot of work, and some people are going to apply to a lot more than others, and some people may accept things a lot earlier than others, but that's okay. Everyone's going to have their own time, and I promise you that it'll work out.
I think that's awesome. I think one important thing you kind of touched on was everyone's going to end up where they're supposed to end up, because as first years, as you start applying and networking, some might get interviews earlier, some might hear back from a company that maybe you were interested in and they were just applying and they weren't even interested. So just kind of keeping faith and kind of going about it, and just going about a process thinking oh yeah, I'm going to end up where I'm supposed to end up is pretty important. Does anyone else have kind of like a different timeline that they had that they would like to share, maybe a little bit later, earlier? If not, we can move on to the next question. Okay, awesome. So the internships for a lot of kind of different industries are usually converted to jobs. In our sense, it's a little bit different for MHA students because we kind of go the traditional fellowship path after an internship. So kind of how do you convert, or how do you kind of leverage that internship to grab a fellowship or gain a fellowship? Celine, can you share some thoughts on that?
Yeah, for sure. So actually, Cornell doesn't require a fellowship route after, so it's very open here. We have people going into consulting, startups, all of that too. But I would say definitely during your internship, wherever you end up, take in the entire experience. And what I mean by that is learn as much as you can within your current role, your current setting, but also look for opportunities for improvement, or, even different gaps that you can identify within your opportunity there. What's lacking in terms of the patient experience? How can I further improve this? Where is there room for innovation? All of those things. So and even, take it as far as, is this organization able to compete with these evolving healthcare trends where, there's digital innovation just popping up all over the place. So keeping all of that in mind, also in this sense, conducting research on the current healthcare trends is so important. Especially in this day and age, there are so many innovative business models that are emerging within the healthcare space. So I'm personally interested in more of the value-based care setting and digital innovation. So, if you want to go hospital fellowship where your program requires a hospital fellowship, that's awesome. Look for opportunities for innovation, even within those academic medical centers or even hospital systems. And again, this might sound hokey, but set long-term goals and short-term professional goals for yourself. And it'll help a lot in terms of identifying, especially if your program requires a hospital fellowship, but you don't necessarily want to stay in that space. Setting these goals will help you plan out these actionable steps that you can actually follow to reach where you want to be eventually. And then I think one thing for me was I had such a great time at Vanderbilt. And almost at the end when when I was applying for fellowships again, I felt like I owed Vanderbilt a return, kind of returning back to the organization because they invested so much in me as a intern and with all the mentorship and resources, all of that. But I think when you're looking for a full-time job, you have to be a little more selfish in that sense. So it is really different in your internship since it's, a 10-week opportunity, but also leverage that because that could lead you into a full-time role as well. So it's really just what you want to make of it in the end.
Awesome. Thank you, Celine. So the next question you all submitted was, are unpaid internships typical? And are they even worth it? Do you guys recommend unpaid internships, or should they strictly focus on paid internships? What are your thoughts on that, Karen?
In my experience, I've had one unpaid internship, but it was back in undergrad. But for a few of I'm in the MPH program, so we all have different ideas going into our graduate programs, as well as what we're trying to get out of it. And so some of them did go into unpaid internships for policy-wise reasons and just to gain that experience. I think they're definitely worth it if you think that you're going to gain a lot out of this. If you think you're going to be able to develop the skills that you're looking for, you really like the organization, you believe in them, and you think that they could take you to the next level in your career. The value or what you get out of an internship doesn't always have to be money or financial gain. It could just be experience. So I would definitely leave it up to you as an individual to decide if you think it's worth pursuing.
Awesome. Does anyone else have any thoughts on kind of moving about applying for unpaid internships or paid internships?
I can just say this one little piece, but there are so many internships out there, and I know we touched on this before. Sometimes you're not going to get a paid internship, and that's okay. And you're going to be surrounded by people who do have paid internships, and that is okay. like Karen said, the monetary value of an internship does not determine the value of what you'll bring, nor the trajectory that you'll have. So I would look at that as a great opportunity to get invested in the organization, and who knows, it might turn into a paid opportunity. You never know. You never know what kind of doors those will open. So I always kind of go with an open mind, and the more experience you get, the better. So that's kind of my little 2 cents in terms of unpaid internships.
And then all of you guys completed, obviously, administrative internships. And can you talk a little bit about what was like the most fruitful thing, kind of some tips if someone were to accept an internship tomorrow, how can they kind of make the most of that internship, or how can they even start reaching out to people in that organization? What can they do currently to kind of just build upon the networking and that internship that they've landed?
So I think, sorry, Justin, I don't know if I completely stole your thing. I'll make it very brief, but I know for me, when I was going into Providence, moving from Georgia all the way to Southern California, for me, I just got to know the people, just understanding the culture, because it's very different on the East Coast than it is on the West Coast. And someone can say it's completely different. They could say it's similar, but for me, being from the South and going all the way to the West, it's completely different for me. So really understanding what the people are like, and then understanding a little bit about, and this could be during the internship process, this could even be way before you even start the interview process, but really taking in that initiative and showing that initiative. And then as you continue moving towards each step and you go to orientation, again, really making sure that you do your research, making sure that you really show interest in like the projects that you're doing. So for example, I was brought on to being a co-lead for a recuperative housing initiative for all of LA County, where we partnered with our hospitals, our medical groups, and our recuperative housing facilities to create a continuous care program for homeless populations. And I knew nothing about EPIC. And so what I did is that I spent all of the time either researching it or connecting with people who knew stuff about EPIC, and worked with our finance team and our RCS team and all this kind of stuff to really just understand how that process works. And that is actually what made me really successful for a project, because I took that extra time to go and dedicate some time into some of the projects there, some of the areas that I didn't really know about. So be comfortable with uncomfortable, take initiative, be passionate, and it's okay to make mistakes. You will most definitely make a mistake. I have made so many, and I am still alive and we're still standing. So yeah, that's the advice that I could give for.
Justin?
Yeah, I mean, Keshni put it beautifully already, but the big thing is just to be very intentional with your time. 10 to 11 weeks it's going to fly by. So be open to different opportunities. Don't be afraid to ask questions, and make yourself known in a room. Introduce yourself and let people know who you are, because most of the time, people won't really take that initiative to come up to you and introduce themselves. And as Keshni was mentioning as well, volunteer and seek ways to just better yourself and also better the organization. For me, I had moments where I didn't have a whole lot on my plate as far as project work, and so I would just volunteer to help out with different visual management boards for the Orthopedics Institute, and got to meet everyone from clinicians, administrators to front desk staff, and I just had a really great time interacting with them and building those relationships.
Awesome. So you guys all touched on kind of a department that you guys were stationed at, or you guys were kind of a part of. A question we had on the Q&A is, how did you decide, or did they decide for you which unit you would be a part of, and kind of what was that process like? Celine, if you want to start us off.
Yeah, so I mean, a lot of times you can apply to the organization's internship and they'll have you rank different departments. There are some organizations where it is corporate level, so you won't necessarily be, in the hands-on department area, but you'll have more corporate exposure. But I mean, definitely you have such great exposure to leadership, and kind of going off of Justin and Keshni's answer from before, I would definitely say, take the first week or even 2 weeks to really get to know the people in your organization, because I mean, one, getting your name out there, but two, when you're working on your projects, it'll cut down so much if you know exactly who to go to, because you can cut out that middle person and kind of this chain of like, who do I go to for this, you know? And yeah, I mean, they'll come to you if they need information from you too. So it's kind of this two-way street. But yeah, I mean, in terms of the department, it was assigned because I personally applied to this department, but yeah, some of them are a lot more open.
Was it different for anyone else, Karen?
Yeah, for me, it was different. I just applied to a general internship, and then my first round interview was just a phone interview. Then when I went on to the second round, it was a group panel. So they had the preceptors for every single department, and they would ask you questions, and then you could kind of get a feel of like which department would be interested in you, because they would ask more questions than the other people in the chat. And then it's kind of like a negotiation between you and them. Sometimes they would approach you, but if you were looking at a different department, you would be able to say that and then kind of express your interest in what you were looking at. But it was just kind of getting like a vibe, I guess you would say, of where they thought you would fit well in their organization, but also for you to get a vibe of where you would fit well with them.
Awesome. So you guys also touched on this concept of having a preceptor. I'm pretty sure a lot of the administrative internships have preceptors. And so can you talk a little bit about your experience with your preceptor, kind of how you developed that relationship, kind of handled maybe if you had any difficult conversations, kind of how you approached them to work on any projects you were interested in?
And go first if no one has anything to say right now. I loved my preceptor. He's an amazing mentor, and he kind of went off the bat and said, my job as your preceptor is to help you do you, which is very informal, but it made sense. And so for me, that made things very easy for me to even just talk to him about, you know, difficulties I had in the organization, maybe just not being able to connect with the West Coast culture because I'm sitting here calling everyone yes ma'am and yes sir, and they're like, call me by my first name. What's not clicking? And so for me, really establishing that contact from the interview, if you have the ability to have a one-on-one interview with your preceptor, even just have a one-on-one conversation with your preceptor, I totally advise to do that, because you get to know your preceptor on a personal level, and you're going to be meeting with them throughout the duration of the internship anyway, so why not start early, right? And so for me, one of the things that I really loved about my mentor and preceptor is that he really put communication as a top priority. So he said, I need you to communicate me if something's going right, something's going wrong, feedback, whatever you have to say, tell me. I'm not going to take it personally, because it's how we can better this organization, how we can foster more interns to continue to grow and help, you know, them get professionally, you know, developed in that sense. And so that was something that I really loved about my preceptor, and it's something that we established well ahead of time. So that's something that I would really encourage everyone to do. Another thing that I would just say is to kind of be open to communicate and be open for accountability. Something that I ask my preceptor to do is, you're not always going to be able to ask people to give you feedback. And even if you do, chances are you're new to the organization, people aren't going to give you that feedback willingly. But your preceptor is usually someone's boss, and they have a connection. Or maybe they know someone who knows that person who can give them feedback. So what I did was I asked my preceptor, you know, in addition to sending out surveys at the end of every coalition I was leading, can you ask your group what they thought about that? What's the feedback that they have about me? What can I do to do better? What can I do to be better as a leader or a communicator or a listener, whatever role I was playing? That was really important, because a good preceptor will always tell you, you know, not only how can you better yourself in the organization, but how can you better those soft skills or those human skills that we really talk about a lot. So that was something that I really valued about my preceptor as well.
And can you talk about like what your preceptor's position was in the organization?
Yeah, so I was in home and community care. So that's hospice, home health, skilled nursing facility, all of those, and then hospital home. And he was the chief of home health. So he was the chief operating officer for all of that for 4 states. So California, Oregon, Washington State, and Alaska. So he oversaw all of those ministries. So yeah,
awesome.
He's a T. He's love a T. So it's nice.
Does anyone else have any great experiences with their preceptor? Any tips on communicating with the preceptor?
I guess this could be sort of a tip, but, you know, definitely try to as Keshni was saying, try to develop that rapport early on, even before you jump into your internships. I was privileged to actually have a GW alum as my preceptor who graduated about 4 or 5 years ago. And she is currently the department administrator on the sports medicine and for the Orthopedics Institute. And so we were able to bond over things like sports. She used to play basketball at GW. So, you're going to develop a really personal relationship, and 9 out of 10 times, or hopefully 10 out of 10 times, your preceptor will be the one writing one of your letters for your fellowships as well. So make sure to, leave a good impression. And as Keshni was saying, as well, your preceptor is really your anchor during your internship, and is going to be the person that will more or less tell you how it is. And so seek that feedback and be once again, very intentional about your time there. Be open to feedback as well. That's part of the learning opportunity as an administrative intern, and something that will be really important as you move through your fellowship interviews, is kind of reflecting back on the feedback that you received and just working on those soft skills, or as Keshni put it, the human skills.
Awesome. Thank you, Justin. And then one quick question. I don't know if it was a similar situation for all of you guys, but what were the hours like? Was it like a normal 40-hour work week, 9 to 5? Does anyone have like anything different that they experienced?
So for some of my projects, I mean, definitely it was very like time intensive and in person, but when you're building decks to present to different leaders, even executive leaders, my preceptor actually let me do that from home. So I had some days where I was able to work from home, but most of the time it was a set like 8-9 hour day. But yeah, I mean, if your project requires more time, especially during the summer, I personally wasn't doing anything on top of my internship. And so if I needed to put in extra time at home, I would, but that's not required or expected of you during an internship. So it's just what you make of it.
Awesome. And then going back to interviews, were your guys' interviews very like behavioral? Did you guys have any case studies, any kind of logic questions? What did the interview process kind of look like? How many rounds were there? Karen, if you can kind of start us off.
For most of mine, there was an initial interview, which was usually a phone call. And then if you moved on to the second phase, then it would be sometimes like one with behavioral questions, or with one individual, or maybe 2 or 3 2 or 3 people that they decide to interview you. So I think it varied on the organization. One organization had only one video interview, and I think they did that to save time, but then that interview was just answering questions, and then they would videotape you. Like it was just using a machine, some kind of software, I forgot what it was called, but then that would be your submission. That was it.
And then someone asked actually on the Q&A, you mentioned the pre-recorded or the higher view interview, I think is what it's called. Do you have any tips? Because I know that can get awkward sometimes, kind of just talking to a camera. Do you have any tips on how to go about that, or kind of how you went about it?
I wouldn't have any tips because I don't think the interview went well for me. That was my first time using that, and it was not good, if I'm being honest. I did have somebody who I knew for my school who went through the interview, and she did get the job for that organization. And then she's very prepared. And so I think she already knew her answers ahead of time. She guessed what they would have asked. So she already wrote down her answer. She already practiced it a few times in front of a mirror before she did it. So I guess that would be my suggestion. Maybe solidify your answer before recording yourself.
Does anyone else have any experiences with that?
Yeah, so some of them will have like a little 30-second time period before you actually have to start the recording. And so they'll give you like 30 seconds to a minute to prepare your answer. And so this is just general interview tips, but I would say have like 3 to 5 experiences that you can easily draw from, like know them, put them in your back pocket. Like you can talk about everything and really adapt kind of the question to your experience and be able to provide a personalized answer to that, because they are looking for these personalized answers. They're not looking for these, memorized, rehearsed kind of facts about their organization, like we mentioned earlier. But yeah, I would say that's just a general interview tip too.
I would also say usually if you look up interview questions, there'll be like hundreds of like thousands of different types of behavioral questions. So I think I saw someone in the chat ask what a behavioral question. It's like a what would you do in this sort of situation? So how do you deal with someone difficult at work? Or what would you do in a situation where you had to make a quick decision with a little bit of context? So those are what behavioral questions are. I definitely looked up a lot of them and just started kind of plotting, saying, oh, this experience would work for this if they asked me this, or this experience would work for this question if they asked me this. And it would leave you better prepared. Also, go out and reach out to people and practice and have them hound you with interviews. Like, so I actually made use of AAHL and how did Chen interview me and just roast me? And they're like, yes, no problem, would love to. And I would just, back to back, would just do those interviews and practice interviews. And then oftentimes, I think your school sometimes will have, like, through their career centers, can also have interview softwares or at least a career consultant. And if you can't find anyone else to do it, they're definitely a wonderful resource. So that's also a really great way to prep for interviews in general, case, behavioral, and other logistical questions that they might ask. So that's something that helped me during the interviews.
Justin, do you have any last minute tips for interviews?
No, I mean, I think everyone, touched on the high points, but for me personally, I had a case question for my interview with Cleveland Clinic. So it was very basic. You don't need to, do any PowerPoints or anything like that, but, think about some of the tools that you'll probably, learn in your quality classes or your marketing classes. Make sure you are aware of things like KPIs and thinking, critically about, competition, market attractiveness, etc. And not a big fan of high review. I'll give you that as well, Karen. I totally, botched my high review interviews as well. But I'm sure somebody out there will do a great job. So.
Awesome. Thank you. So I know some of you had kind of through your internships, you were either an individual interview and an individual intern and it was just you by yourself. But I know some of you also had cohorts. And so can you talk a little bit about kind of what that cohort experience was like, and kind of how to go about the cohort experience, how to make it like the best possible experience while you're there stationed at the health system?
Celine, you can definitely take
Okay.
this. Yeah, go ahead.
I was with 4 other interns and I loved it. A lot of our projects, so we were all in different departments, but a lot of our projects did end up overlapping. So having someone kind of at the intern level that you could talk to, even just from a project standpoint, even just with the processes that they were going through on their side in their department, it definitely gives you so much insight into things that you can apply into your own projects. And even outside of that, most of the time you're going to be in a different city than you're used to or you're used to living in. It's really fun getting to know the city with your cohort and kind of exploring that scene as well. So, I'm sure I personally have not had an internship where it was just me, but I loved the cohort model.
Yeah, I would echo everything Celine said. I really enjoyed my cohort model. There were 15 of us placed across different institutes and departments. But unlike Celine, I think most of our projects did not overlap. But, we were all in Cleveland. I think most of us were out of state, minus some of the Ohio State students. And so it was a really great opportunity to just make friends and build relationships. These are all really great individuals that will hopefully become your lifelong friends and will be a connection for you as you progress through this realm of healthcare administration and healthcare management. So, take the time and just have a lot of fun. Of course, there's going to be a lot of work and your internships will be, very busy, but take advantage of the fact that you're in a different city if you do happen to go out of state and just really enjoy it. Sorry, the Ohio State, I apologize.
Worries, thanks.
Did anyone else have a cohort model, Karen or Keshni?
Yeah, I had my group was 10 people, and when you first get your membership internship, sometimes people post on LinkedIn that they have one. And so that's how I found my group. And so we all found each other on LinkedIn because some of us posted, and then word got out of who was going to be there this summer. So then we made a group chat right away. And then that was probably the best thing ever. We've been using it a lot. Even after the internship ended, we are still asking each other how we're doing and like what the next steps are in our career and like if we need help with anything. Because everybody came from a different school, so they had a lot of benefits and like experiences. And so then they had a lot more resources than what I could have came up with on my own. So I would say like really utilize your communication with the other interns as well.
No, I think the cohort model is great. Just networking with them and just, they're always going to be future individuals and future executives. So just keeping that relationship with the cohort members is pretty important. And just having fun, like Justin and Celine mentioned, you're going to be in different city potentially. So just getting to know them personally and not just making that a work relationship is pretty important. And then as we kind of end off this internship panel, can everyone just go around and talk about your favorite thing and your least favorite thing about the administrative internship that you experienced?
Sure, I can kick it off. So favorite thing would definitely, just be the opportunity once again to just develop relationships with people and primarily the different interns. I'm actually going to meet up with one of my fellow former interns from Columbia. She'll be coming to DC over the weekend. And so just the opportunity to develop those lifelong friendships and relationships has been really awesome. And least favorite part of my internship was, it's not really related to an internship, but probably having to wear a suit and tie every single day. Cleveland Clinic was like a very corporate setting, and so in the hot summers, and then most of the time the interns get a parking lot that's like a mile away, and so yeah, that was definitely brutal. But I had a really great time there and wouldn't trade it for anything.
My favorite part of the internship, just really being challenged and being pushed out of my comfort zone. My preceptor, basically an analogy that I would talk about is that I would tell him that I was uncomfortable with this and he would literally just push me into the deep end. That's what he would do. He's like, you need to be exposed to this, so be uncomfortable with the comfortable. So that was something that I really loved and was like, okay, wow, this is what it's going to be like. Great, cool, that's fine. Also really love the people there. Least favorite part of the internship, again, not really related to the internship, LA traffic. Not fun. Also, when you're coming from Georgia and you're in a rental car and you're driving and you're afraid of getting nicked, it's horrifying. So yeah, that's my least favorite part about the internship is the traffic. But yeah.
I can go. So I would say kind of mirroring off of them, the best part of my internship was the culture and really getting to know everyone in the organization. So the fellow that was actually one of my preceptors, he knew everyone. Like he would walk down the hall and say hi to, kitchen staff and executive leaders and everyone in between. And I think this made a really big impact on me because it really nailed down the fact that essentially you're going to be managing people at some point. And building those relationships even early on is such a powerful tool that you can leverage now and later too. But I would say my least favorite part is during my projects, and I'm sorry if there are any physicians on here, but getting physician buy-in is very difficult in a project. But I think that's what really led me to pursuing kind of the digital innovation space because they're very, very receptive to data. And I think once I realized that, I wanted to see how I could, further pursue that so that I could kind of keep it in my toolbox when I need it for projects in the future. So.
This definitely was an interview question because I've had this question asked to me. Let's see. My favorite thing was definitely the networking. We were in our internship, we had weekly meetings with the leader. So it would be a different leader every week and we got to meet with him, ask our questions. And then it was also an intern led. So we had to be really responsible for what we were doing and like what questions we were going to ask. So that really helped us really try to do well and then like really try to get to know the leaders within the organization. My least favorite thing, also not in regards to my internship, was the cost of living in Boston. Everybody tells you how much it's going to cost, but I didn't believe it, and it did not pan out well financially, but it was a good experience.
Awesome. Thank you guys so much for sharing. So I just want to thank all the panelists and all of you guys that have joined from across the nation. Thank you all for joining. Hopefully you learned something valuable about the administrative internship role. If you kind of jumped in halfway and you want to catch the earlier questions, we are going to post the recording on the YouTube channel. So go ahead and check that out over there. And then also go ahead and follow the LinkedIn page. But if no one else has any other questions, I think we are good to end.